wanted to let you know about two important rules that the federal government made in the early 2020s. They were supposed to help us all as consumers understand the cost of healthcare in the market, and that's both on the hospital side and the insurance side. And so these rules are called the Transparency and Coverage Rule, and that applies to insurers, and the Hospital Price Transparency Rule. So you all know that there's not really a marketplace that's functioning to keep control over costs in healthcare. And one of the reasons is that nobody really understands what the costs are going to be, right? So you go to the hospital and you don't know what the bill is going to be for, or you can't really research ahead of time when you're getting your insurance exactly what the negotiated rates are for certain services, and neither can your providers. So these two rules that were enacted were really aimed at increasing transparency so that we can drive down costs in the market with better competition, more understanding of, okay, if hospital A is charging $10,000 for this procedure and hospital B is charging $8,000 for that procedure, and I feel really good about hospital B, I can save money by going to hospital B. But you have to have that information in front of you at the right time in order to make that decision. So the government enacted these rules, and it's so great that we have them, except the hospitals and the insurers really aren't complying in the spirit of the law. They've complied in the sense that they've provided these enormous files with information that are completely unreadable. It's funny because they're actually called machine readable files. So check it out, do a little Googling, and you'll see these files are filled with information. They're so big, I can't download them on my computer. I wish that I could work through them to understand the cost of different care, but it's actually impossible for me to do. So then other companies have to buy that data and work through it and then sell you the information. I want you to understand that the government clearly knows that we need more transparency in healthcare, and they're trying. But industry, and in this case, it's the hospitals and the insurance companies, don't want to provide clarity into cost. They think that the price of their product is a secret, and that's ridiculous, right? If your product is great, don't keep the price a secret. Let me understand how great it is, and I will buy it if I want it. But this current situation where we don't know how much we're going to have to pay is just insane.